goal of this presentation is understanding how to recognise muscles, their specific architecture and characteristics, when scanning them with ultrasound. A muscle has different parts. One of the smaller entities of a muscle is a myofibril. Multiple myofibrils together make a muscle fibre. This muscle fibre is surrounded by the fascia, the endomysium. Multiple muscle fibres together make a muscle fascicle, which is covered with perimysium. And all muscle fascicles together create the whole muscle belly, which is surrounded with epimysium. Knowing this muscle anatomy and being able to recognise the different parts is important for muscle pathology recognition. On this slide, you can see on the left side schematically the muscle anatomy and all mysium layers. On the right side, you can see an ultrasound image of a muscle. Please note the hypoechoic muscle fibres. The clear hyperechoic lines are, in fact, the mysium fascia, like, for example, the perimysium and the epimysium. With ultrasound, a muscle can be assessed longitudinal or long axis, and it can be assessed transverse or short axis. Now you will have to start thinking three-dimensionally and in planes. I know this can be very challenging, so let me use the following example to explain the matter. In this example, you will see two pictures of a cucumber. The difference between the two pictures is that the cucumber has been cut in two different planes. On the left side, you can see it has been cut lengthways, so longitudinal or long axis. On the right side, you can see it has been cut in its short way. This is called transverse or short axis. With a longitudinal assessment, you can visualise the length or thickness of a certain tissue. With a transverse assessment, you can visualise the width or thickness and the cross-sectional area of a certain tissue. I hope the cucumber example makes it easier to understand this slide. So in the left image, you'll see a longitudinal muscle, therefore all muscle fibres are depicted in a long way. In the right image, you'll see a transverse muscle. We can see the cross-section of a muscle. Now let's zoom in for a minute on this transverse muscle. In this image, you can see the muscular fascicles and hyperechoic perimysium septa. Let me highlight one muscle fascicle of many in screen. This is one muscle fascicle. Do you recognise it? Within this muscle fascicle, you can see tiny hyperechoic dots. These dots are the endomysium of one muscle fibre. Let's focus on this muscle fibre with endomysium. If we were going to magnify it under a microscope, it would look like this. You can see the pure endomysium tubes with the muscle fibre filtered out. As you can see, although the muscle fibre has been filtered out, all endomysium tubes still have their octangular shape, meaning they have a certain firmness, a hardness. This firmness shows that the endomysium is more hyperechoic than the softer muscle fibres. This slide shows an ultrasound scan of the upper leg. In the upper left image, a transverse view of the femur and all four quadricep muscles can be seen. The image has been taken on the most proximal indicated transducer position. Each muscle belly is covered by hyperechoic facial epimysium. You can see the internal muscle architecture of muscle fibres and peri and endomysium. The upper right image has been taken on the most distal indicated transducer position. You can see a longitudinal scan of the rectus femoris muscle with the underlying vastus intermedius. Please note the long muscle fibres in both muscles. There are many different types of muscles in the human body. Here you can see the three most common types. First, the fusiform muscle, a muscle with lots of parallel fibres and resulting in lower strength but great shortening and movement velocity. Second, the unipennate muscle. The fibres are arranged at an angle to the direction in which the tendon moves and are inserted on one side of the aponeurosis. This results in a greater area of muscle fibres along the axis of contraction and produces more strength at the expense of a reduced range of shortening. Third, the bipennate muscle. The fibres insert on two sides of a central aponeurosis. This arrangement produces the highest strength but lower shortening of the muscle. The different types of muscles can also be recognised in ultrasound. On the left side, you can see a fusiform muscle, and on the right side, an example of a bipennate muscle. So by looking at a muscle's architecture with ultrasound, you can also reason a bit better about its biomechanical function. The intramuscular aponeurosis, the core of a bipennate muscle, appear as hypoechoic bands which are usually better assessed on the transverse images of the muscle. Are you ever in doubt whether a muscle is contracting as it should be? Do a functional assessment. Ask the patient to contract the muscle or apply resistance to a certain movement. Visualize the difference and make thickness or cross-sectional measurements to quantify the change in muscle volume. It may help your clinical reasoning. If you're going to scan muscles, please bear in mind the following points. The patient should adopt a comfortable position so that initially there is a complete relaxation. This is important to standardise and to avoid misinterpretation of any findings. If a functional measurement is desired, you can initiate a muscle contracting while scanning. Always scan in two planes, both longitudinally and transverse, especially if you suspect pathology. Please bear in mind that the hard pressure of a transducer leads to the compression of superficial anatomical structures. This leads to false interpretation of findings, as you have not scanned the muscle in anatomical dimensions. Therefore, it's important to scan with a very gentle transducer pressure to avoid this. Compression is to be avoided. Sometimes you'll have to add more compression if you are to scan very deep structures. In that case, the compressed superficial anatomical structures are acceptable. Focus will only be on the deeper structures. With compression, you can sometimes see in a little better depth.